if you're 16 years old and you're healthy and you're in high school and you have no risk factors, you don't smoke, you don't drink, your weight's normal, you're a happy child, we generally don't think of that person as having heart disease. Now, if you're a diabetic, you're a heavy smoker, you have a strong family history of heart disease, you have an elevated cholesterol that you don't treat, you're overweight, you're sedentary, and you come in with some chest pain, that's the group that we really then begin to say, look, you know, this person is at risk of having heart disease. And so whenever you develop symptoms like, for instance, chest pain, shortness of breath, decreased exercise tolerance, pain that is different than some pain you've had for years. For instance, women and men oftentimes have different symptoms of heart disease. A typical symptom of heart disease might be, say, a 55-year-old heavy smoker, diabetic, strong family history of heart disease. If that fellow came to the emergency room and said, you know, I woke up this morning and I had this terrible pressure, like an elephant sitting on my chest, and I got all nauseated and sweaty, and the pain then kind of went down my arm and went up into my jaw. Most physicians would say that's classic angina or chest pain from the heart. And about 95% of the time we're going to be correct. If say a 50-year-old female came to the emergency room and smoked a little bit, family history wasn't necessarily too impressive, and she said, you know, I just got this funny stomach pain, I'm not sure what it is. Most of the time, we're going to be thinking about 1,000 other things. Gallbladder disease, ulcer disease, gastroenteritis. Sometimes those can be symptoms of angina. Those can be a different symptom class than, say, another person would. Not necessarily always male, but because both men and women can both have the classic symptoms of heart disease, but everybody doesn't have the same. And I'm using men and women like there's two different animals that have two different symptoms. Sometimes the symptoms are classic in both, but sometimes they exhibit very different symptoms. I'm going to talk to you a little bit about not only heart disease, but vascular disease in this day and time, because in addition to the symptoms that we classically see for heart problems, we also see symptoms that are related to the entire vascular tree. Now, patients always ask, well, you know, what causes this vascular disease thing? And I run through the list of things. It's smoking, diabetes, high blood pressure, lack of exercise, elevated cholesterol, dietary indiscretion, family history, sedentary lifestyle, and probably a multiplicity of factors that we're not smart enough to know about yet. So there are things on the molecular basis that, you know, maybe a deficiency of this vitamin, or maybe an inborn error of metabolism. So there are lots of little things. But also, it's important because you all see it on the television all the time. They'll say, the ads will say, you have peripheral artery disease, PAD, or claudication, and in the next sentence they say that can be a killer. Well, they're sort of stretching the facts, and they're sort of using that as a marketing tool, but I'm going to get back to why they're using that, and that is, as we age, and as we do good or bad things to our bodies, things can change. So as we get older, everything changes. You know, our skin changes, our hair changes, you know, our blood vessels change, our lungs and our kidneys, everything changes. Everything sort of ages. In the old days, we used to hear our grandparents always talk about hardening the arteries. And we all kind of knew what that was. We knew that granddad or grandma, they were going to have strokes or heart disease or whatever. Well, in actuality, what they were really saying was, as we age, our arteries change, just like our hair changes and our teeth changes and our skin changes. And we know that beyond a shadow of a doubt because Vietnam War. There were a lot of kids that were 18, 19, 20 years old that died. And when they did autopsies on those, they actually found in the arteries of kids that young that they had the beginnings of the atherosclerotic process. They had little plaques, little sort of small areas in the blood vessels that were beginning to show areas of cholesterol accumulation. So fortunately, in this day and time, we have some non-invasive ways of evaluating patients. Non-invasive meaning we're not going to stick you, we're not going to poke you, it's not going to hurt you. One of the non-invasive ways is what's called a nuclear scan. And this is sort of a little picture that's depicting what a nuclear scan shows. Obviously, these are the hearts. And what we're going to be looking at when we look at the heart under a nuclear scan, the heart obviously has blood vessels that run on the surface of it. And when those blood vessels get blocked, that's when you can have a heart attack or a problem. The valves are inside the heart. So the nuclear scan is really not going to tell us much about valves. It's going to tell us more about the blood supply to the heart. And when you see this nice little donut that's all red, that's a good thing because that's showing equal all the way around. But as you go down here, you can see all of a sudden this donut is no longer a donut. So about half of this heart is not getting blood. That then tells us, hey, whoops, something's wrong there. You don't necessarily always go to a heart cath or always think about doing angioplasties or always doing heart surgery unless you have something that's abnormal that's heading you in that direction. Heart model actually shows a heart that has had some bypasses. These little red, look like spaghetti tubes here. Those are actually the depictions of what we do in terms of bypasses. We actually, this is depicting the saphenous vein, where it's a vein from the leg. You hook it onto the aorta here, run it over, and hook it to an artery. This is what's called the internal mammary artery. We take an artery down from the chest wall. It's already connected to a blood vessel normally, and then we run it over and put it into another blood vessel. So this is a depiction of someone that's actually had a coronary bypass.